Hi, I'm Kristen Whitney with the University of Maryland Midtown campus. I'm here today with Dr. Onigbanjo, Assistant Professor of Medicine at the University of Maryland School of Medicine and Medical Director of the University of Maryland Pediatrics at Midtown. Dr. Onigbanjo, now that kids are not physically going back to school in the fall, does that mean they don't need to get vaccinated?
So that is a great question. So whether or not kids go to school or not, they are still at risk for vaccine preventable diseases. So we really do recommend that they get vaccinated on schedule to ensure that they don't become susceptible to diseases such as chickenpox, measles, and whooping cough.
Is it safe to bring your children into the doctor's office to get these vaccines?
So that is a great question that a lot of families ask me, especially in our current situation with the pandemic. It is safe to bring your child to the doctor's office. Some of the precautions that many doctor offices are taking are temperature screenings. They're screening for COVID-19 symptoms. They're also taking precautions to make sure the environment is safe. So beyond what we usually do, we're cleaning more often, we're cleaning high touch areas, and we really do recommend universal masking for staff, patients who are older than 2, as well as their family members to really decrease the risk of acquiring COVID in the doctor's office. If you have any question about whether it's safe for you to come to the doctor's office, you can always call your doctor to get a good sense of what precautions that they are actively taking.
So sometimes children get a little worked up over getting a shot. It can be a little scary for some of our kiddos. What would you recommend to parents to help soothe some of those fears they may have around getting immunizations?
So not every child likes their vaccine. Some cry, some are excited. Families are usually nervous. But some of the things that families can do to make sure their child feels comfortable, the first as a parent is to remain calm yourself and be relaxed. Your child feeds off of your energy. So if you're nervous as well, they may kind of feed off of that and also become really nervous.
Great.
You can bring things that they really like to the office. So some kids like their pacifier when they're younger. Other kids have a special toy or a special book. You're more than welcome to bring that to the visit. Really, while they're getting the vaccine itself, you can give them a really good bear hug to make them feel comfortable. You can sing their favorite song or count, doing things to kind of distract them from getting the shot themselves. Most kids do really, really well with that, and at the moment may cry, and once they're gone, once it's done, they feel pretty comfortable and happy. There are other tools that are also out there. They're like we call something called the Buzzy. It's a little toy that looks like a bee. It actually vibrates when you use it. It has a cold pack, so when you put it against the skin, it's a little bit cool. And what it does is with it vibrating and it being cold, it kind of numbs the area. And when you give the vaccine, the child notes that they don't feel as much pain because it does a really great job distracting them from the shot itself. So there are many tools that parents can use in their pocket to keep kids feeling okay while they're getting the shot and not so upset.
It's funny you mentioned Buzzy Bee because the last time I received some vaccines, I wanted to see what Buzzy Bee was, and it's just a cute little small device, handheld device, and it worked on me, so I fell for it.
One, yeah.
When a child gets vaccinated, what's the best time period to do that? Is back to school the best time period, or what would you recommend?
So the American Academy of Pediatrics and the CDC puts out routine schedules for when kids should get vaccinated. So we really do recommend following the schedule. There are vaccines from birth to adulthood. So there's a vaccine when your child's born. There's the vaccines at 2, 4, 6 months, 9, 15, and on and on. It's really important to work with your pediatrician to make sure they are up to date and getting the vaccines at the appropriate schedule for your child.
And does the University of Maryland Medical Center Midtown campus offer these immunizations?
Yes, we do. So in addition to routine pediatric care, We offer vaccines on schedule. We also offer catch-up vaccines for kids who are behind. And we also provide additional vaccines for kids who have special needs that need additional protection. So we do offer both well visits as well as an opportunity for kids to receive their vaccines.
Thank you again for being here today, Dr. Onigbanjo. And for our viewers, we hope that this answered some of your questions about vaccines and immunizations. If you have additional questions or concerns, or would like to learn more about the University of Maryland Midtown Campus Pediatric Services, please feel free to give us a call at 410-225-8780 to speak with a provider. Thank you.